what sound therapy is, what it does, is quite interesting. If I had to focus on one part of the science, because there's quite a few different pieces, but one part that really stood out to me, it was that in our brain, there's all these different things happening. There's all these different pathways. There are a few with the auditory process, and two that I'll point out: the non-classical and the classical auditory processing pathways. So as we continue to grow, at some point, our brain understands that we don't need the non-classical pathway anymore, and it sort of shuts that off. What happens though is that many people that are considered to be autistic and diagnosed with that, they've come to understand that that non-classical auditory pathway never gets turned off. So, in essence, that part of autism where there's a high sensitivity to different sensory inputs like sound and light, a lot of it does have to do with this non-classical pathway not being sort of shut down when it's supposed to be. So this sound therapy is known to do that, to help with that process. So it does that, and it does a few other things. If I had to break it down, it's about 15 minutes, 5 days a week, where you're listening to this music, but in the music are certain specifically tailored frequencies that sort of help retrain the brain and that auditory processing, classical and non-classical pathways. And so when I found that out, I started to utilize it myself. And then when I felt comfortable doing that with myself, I offered it to my clients and have seen a lot of significant change when it comes to autism spectrum disorder, and helping the people with autism really ground themselves and feel a little bit more comfortable in their body.